In Barnsley, we have something important to say about young people's mental health, and we are making our voices heard.
This is our call to action for 8 key recommendations we want to inspire action. We aim to get children, young people, families, communities, professionals and politicians to focus their attention on emotional well-being and mental health for young people.
The Our Voices Matters in It Manifesto is our call to action to promote the needs for young people in Barnsley based on key findings from talking to young people.
We want Barnsley to ensure resilience, emotional well-being and mental health are prioritised and transformed for young people today, and to create a great mental health friendly Barnsley now and for the future.
These fictional stories illustrate the key problems real young people face every day and how they can be improved by Barnsley services and community.
I go to a youth group that has a peer mentoring project for young people in the community. It is really good because other young people who are all have similar experience and understanding run it. Peer support unites us. It gives young people a chance to come together and talk about our issues openly with each other. We make new friends at the group. We have a laugh and build our self-esteem and confidence at the same time. I've built a great relationship with my mentor. The group has fun activities and gives me a break from home, away from my care and responsibilities, which can stress me out a lot. I even get access to a quiet space to catch up on my schoolwork. Providing emotional care for my mum, who has a mental illness, is important, and I am glad to be there for her, but sometimes I need time for me, which I recognise now. It would be great to see this kind of support in other places which young people who need help use, like mental health inpatient hospitals, supported accommodations. If young people work together, it will unite us.
I've had anxiety since I was really young, but I didn't realise for a long time that what I was experiencing was a mental illness, because I only understood the physical symptoms I had. I didn't know they were caused by anxiety because I didn't know how it could affect people. It took a long time and a lot of medical appointments before a doctor explained that what I was going through was in fact anxiety. Up until that point, I didn't even know what anxiety was. I was really stressed. I started to understand my illness more when I got the counselling support. I couldn't help but feel that other young people might be feeling the same way as me, not knowing why they felt the way they did. With anxiety and mental illness, it's what is left unsaid that is a huge issue. I remember seeing a campaign poster displayed around the secondary school. It was the first time I'd seen anything about mental health openly mentioned like that. I think that if talking about your emotional well-being and feelings from an early age was taught in every primary school and secondary school and college, I would have felt less alone and isolated from others whilst growing up. Looking back now, other young people could have understood how I felt, and that I could have been able to connect to them and get support for mental illness if things weren't left unsaid.
I recently lost my dad to cancer and I found it hard to cope. I needed some support around depression, but I didn't know who to turn to or where to start. My mum encouraged me to see my GP, and my GP referred me to a mental health service. It was all quite daunting and scary. I didn't know what was going to happen next. I was told I would be contacted by the service to book an appointment. I didn't get a phone call, and it had been a few days since the doctor referred me to the service, and I was starting to feel more worried. I was really stressed. I felt stuck in a hole, and I'd actually talked to a professional about how I felt, and somehow I still felt stuck. Then I got my first appointment letter 1 week after visiting the GP. I didn't know anything about the service I was referred to, which makes it really intimidating, but I hoped I could get help from them to make me feel better. But I was worried. What if someone saw me walking into the building that I know from college? Would they judge me? If only the service had called me or sent a text explaining who I was going to see and giving me a way to get in touch with them to ask them what treatment they can offer me. It would be even better if they could meet me outside of the mental health service building in a space I felt comfortable going to. Help us help others to no longer feeling stuck in a hole.
I guess my family can be a bit complicated sometimes. My dad lives in Thailand and me and my little brother, who is free, live with my mum. Mum has to work a lot, so it's up to me to look after my brother most of the time. I don't hang out with my friends as much as I used to because I don't go to school anymore. I didn't like it anyway. After school finished, I spent a lot of time at home with my brother and didn't get out much. I started to feel different and didn't know why. Then I was diagnosed with depression and anxiety. I was really stressed. I didn't want to feel like that anymore. I wanted to get help. I was referred to counselling, but the counsellor didn't really get me, and that made me frustrated. I didn't think it was helpful, so I stopped going. But then I got involved with what's called the Service User Involvement Group that the counselling service ran once a month. It's where everyone who has had counselling can talk about what it was like, things they'd like to be different. Together, the Service User Involvement Group made a young person-friendly waiting room with young volunteers from the local college, so that it seemed less clinical and more open and approachable for other young people like me. I want to help others that use the service to understand their rights. So I created a book specific for the service around me. I think that all services and organisations should listen to the opinions of people that use the service in voice and influence work. It changed my mindset and really helped me get better when I realised that I could be a part of something that changed things for the better. Picture this. All you have to do is ask and involve us.
I live with my uncle now because my parents passed away after an accident a few years ago. I haven't really been coping well. My uncle tries to understand and help, but he doesn't get it. My school had no idea about what to do for students struggling with mental health and gave me no support. My friends at school tried to understand but didn't always know what to say or how to help. Most of the time I just didn't want to be around people, but I know they tried looking online for tips or how they could support me. My uncle got in touch with local youth services, and now I've started regularly going to the sessions there. The youth worker there gets it, he makes me feel understood, and that helps. I've made some new friends at the local youth centre who also have mental health problems. They really understand, and now I can talk to them. It feels like I have a good group of peer support now. I've been referred for counselling, and I think the counsellors are very supportive and they don't have all the answers. Now I want all professionals, schools, colleges and youth workers to have mental health training. I think it's really important for everyone to get greater understanding of mental health problems and the impact it can have on someone. I know that together we can create a good mental health friendly Barnsley.
I've got my GCSE exams this year and I get a lot of pressure from my parents to do well. Both my parents are doctors and they've always wanted me to be a GP too. My mum just had a baby too, so now I have a sister and I'm not an only child anymore. I'm doing okay at school, but I've had to work so hard on my revision and homework and I'm not sure I can keep it up. I used to really like school, but now all I can think about is how I have to do well in my exams. I feel like I need to look a certain way, like my friends who seem perfect. I think they think I'm not pretty enough to hang out with them. I was really stressed, that's why I stopped eating regularly and my parents referred me to an eating disorder service. I think it sounds like I may have low self-esteem and anxiety. I need more emotional support from my parents, but since they had the baby, I know they're really busy and I feel like they don't have time for me as much. So much stress and pressure is building up and all I want is to learn how to get support. If only we could all build awareness around services, support and self-help coping strategies and mechanisms to keep it real with young people who are struggling with school and peer pressure.
I feel like because I'm non-binary, acceptance of my identity has created a lot of stigma amongst my family and the village where I live. No one seems to understand being non-binary and I feel pushed away from a community I wish supported me. I spoke to my GP as I was feeling displaced from society and everyone around me. I got referred to the college counsellor for 6 sessions, who said my homework was to think of something that makes me smile. Some days I couldn't even think of anything other than how upset and alone I was. After 6 sessions, I didn't feel any better and was referred to the adult mental health team. In my first appointment, I was told I was too young for the service. It just reminded me of how alone I felt, not only within the community, but also within the services and accessing support. I was told that children and adolescent mental health services may better meet my needs. In my first session, I asked how many sessions I would have with them. The worker was really cool and kind and answered asking me how long a piece of string was. This straight away made me feel at ease and made me smile. I smiled because I felt welcomed and felt able to open up. I was also signposted to the LGBT forum, which opened me up to a community of like-minded people. For a long time, I felt like I didn't fit into society, didn't fit into my family, and didn't fit into the services that could help me. But I was really stressed. But I started to feel a sense of belonging with support from my counsellor. Counsellors should take time to build relationships with us, not limit our time to a certain number of sessions, because we are all different.
I used to secretly self-harm a lot because I thought it was helping me cope with my feelings. People didn't know I was struggling, so I was an A-star student with no problems through everyone else's eyes. But I saw something else. I knew I was really stressed. I called confidential phone lines, but every time I was getting somewhere, I was told I could only stay on the phone to them for 35 minutes. I researched online and found some online forums where I talked to people around the same age as me in similar situations. Some websites weren't so helpful around self-harm and could be very damaging for young people. So I was referred to the children and adolescent mental health services, and despite a long waiting list, when I received their support, it was the best support ever. In the first session, I was asked to wait in the waiting room that was very clinical, dark and daunting, and straight away it made me feel anxious. I told the worker that the waiting room made me feel like that, and they said that they would take this to their service user group. Then 6 months later, the service user group repainted the waiting room in neutral colours and made it young person friendly, with beanbags and comfy cushions. They even got the staff to dress up on the welcome posters so they seemed less intimidating and more approachable and fun. Although I was seen as intelligent, hard-working A-star student, I still found it hard to find the support that is out there and available. I have to find my own coping mechanisms, but I didn't know there was a better support available before I met my worker at the mental health service, so I just looked online. I wish all people knew the mental health knowledge isn't understanding.
These stories show the kind of discrimination, rejection and pressure that young people face when dealing with their mental health, but you can help make things better for us by following our key recommendations.
Unite us by setting up peer support services and therapeutic group work activities.
Don't leave things left unsaid by raising awareness in schools and colleges of mental health so young people know where to get help.
Don't let us get stuck in a hole by helping us find services we can access with an online directory and better signposting.
Involve us in shaping the services and support we need as we're the experts in our own experiences.
Create a right mental health friendly Barnsley by providing more training and support for families, friends, teachers, youth workers, schools and colleges in our communities.
Keep it real and try to understand the pressures we face at school, home and with our friends, and help us develop coping strategies.
Take time to build relationships with us to make us feel comfortable to speak about our mental health.
Acknowledge isn't understanding. We need the support services we access to feel less clinical and more young people friendly so that we feel understood.
Read more about our consultation findings in the Our Voice Matters in It Manifesto and help make Barnsley a more mental health friendly place.